This week's topic is chronic lower back muscle tightness or tension. Let's talk about addressing the root of the problem, and we'll get into the long-term strategies. My name is Dr. Ryan Peebles, and I've dedicated the last 20 years of my life to better understanding and reversing the root causes of chronic lower back pain. You really have two different things going on when you have a chronic back problem in most cases. You have injury or potential injury to the tissues. So maybe the discs are injured or degenerated or bulging, or maybe some other tissue in there is inflamed. You have the injury or the potential injury and it needs to heal. But you also have the muscle imbalances, which in most cases are related to the cause of the injury, and you have to restore balance in your body. And these are almost two separate things that you have to address simultaneously, and both of them to be able to get out of the cycle of pain. So with regards to healing, and I have the asterisk next to it because it is associated with protection. Not only do the back muscles tighten to protect an actual injury, so if we were able to heal that injury, the back muscles would not need to tighten to protect them. So the actual physical healing of the tissue, but also it may be more of a perceived injury that the back muscles are protecting. So healing would also cross over into the mindset. And this is where the confidence and the fear comes in. And so healing the tissues of the body is part of healing, but healing the thought and the state of the mind is also part of the healing. Because it is possible for tissues to heal, but fear to not go away from trauma or years of something like chronic back pain. And so I do believe the mind is something that needs to be addressed equally or more than the physical body in this entire process. And so healing could allow for the lower back muscles to let go and to feel safe, to not have to protect anymore. So this is associated with the protection factor. So how do you heal? Let's talk about how you can allow the tissues to heal. And if it's the mind that needs to heal, then that's actually going to be another profession that what I'm dealing with. But part of this restoring balance and developing healthy movement is going to involve confidence and trust in your body. So that's going to be part of the healing process as well. So let's talk about how restoring balance in your muscles, muscular balance in your body, can allow for a herniated disc to heal to some degree. Not that you can restore the disc back to the way it was originally, which I have an entire live stream and video on that, but the injured part of the disc that may be continuing to get injured through repetitive trauma, that can heal up, just like a cut on your skin, where the skin can heal up, but there may be scar tissue. There will probably be scar tissue on the disc, but it at least can actually heal to some degree. And if that can happen, then potentially the pain associated with that injury or potential injury can go away. So restoring muscular balance, in my biased opinion, is a huge factor in that. And so there's exercises you can do to restore muscular balance, such as the bridge is one of the most powerful exercises on the planet to simultaneously address tight hip flexors and weak inhibited abdominals and glutes. So there are exercises you can do. One of my favorite go-to exercises, if my lower back muscles are in a chronic tightened state, is the back anchor progression. If you're in the program, you know what the back anchor progression is. It's day 3. It's in the free trial. You're using all of your abdominal muscles to elevate your pelvis, or at least unweight your pelvis. So all of your abdominals are active, and in some cases your glutes as well, if you need a little help from your glutes to unweight your pelvis. And guess what is getting lengthened and relaxed by reciprocal inhibition in that process? It's your lower back muscles. So as a real practical thing you can do, something that I do, I talked about how I lay over the pillow and breathe. Another thing that I do is the back anchor progression, and I'll just hang out in that position for 5 minutes straight or longer and just breathe and just literally let my back kind of decompress as my lower back muscles are inhibited by this exercise. My abdominals are engaging in a healthy way. It's not like a sit up or a crunch, which is not necessarily a functional, like healthy way to engage the abdominals, but that gentle back anchor push away progression activates all the abdominals, a little bit of glutes, and you can do the marching and get a little movement in there and just spend a lot of time doing that. Not only are you getting a short-term relief through relaxation of the lower back muscles, even maybe a real gentle stretch, not really, but very gentle, but you're also restoring balance in your body at the same time. And by doing the marching, you're training your body to be able to move in that state of abdominals are more active, lower back muscles are less active. It's this process of restoring balance that is a long-term strategy. You can't change the sculpture of your body that is sculpted by muscle tone and muscle length overnight, or even in a period of a week. It takes months to change the makeup of the tissues of your body. They need to change shape and change tone and break out of patterns. So the exercises in the program are laid out in a way to help restore muscular balance. And at the same time, we're also learning how to move, which I think is the most challenging thing. I mentioned it briefly in the beginning when we talked about patterns. So just to associate, balance is going to associate with compensation. If you have muscular imbalances, then the lower back muscles typically are compensating for other muscles that are not doing their job. And movement is going to associate with pattern. So we need to develop a healthy movement pattern that can maintain the balance that we're striving for, that we're creating in our body. What's involved in a healthy movement pattern is confidence, is strong connection to the synergy of your body, not only certain muscles that you favor, but also all the muscles. And we can take a look at this picture here, the abdominals, the glutes. It's not that we are trying to use only these muscles. They should be working in synergy with the lower back muscles and the hip flexors. All of these muscles are good when they are working in synergy like this, but the predictable pattern is that certain ones are prone to becoming overactive, hypertonic, and other ones are prone to becoming inhibited and hypotonic. And so the movement is really the key element in being able to maintain and constantly communicate to your body how you want it to be. And so learning how to move with a healthy, subtle connection to certain muscles is how you can maintain that balance that you may have used exercises to achieve or to restore, which would then allow the tissues to heal. The healing can take place as the balance is restored, but the movement becomes key in maintaining the balance, and also it requires healing as well. It requires that you feel confident in your body, that you trust your back, and that you've developed a healthy core connection. And so this is the hodgepodge of all the factors that I believe it takes to get those back muscles to let go for whatever reasons that they are holding in that chronically tightened state. And there are more short-term relief methods that we could talk about. There's a ton, and some of them are more effective than others. But the focus of the program is typically not on these things, because so many other programs and treatments and healthcare modalities are in this category. Those are always available to you to do simultaneously with the strategy of the program, the healthy movement and the restoring muscular balance, and identifying that healing your body requires these things to happen. And also it is not just a physical thing, but it's also a mental component. It's a mindset thing too. Thank you guys all for being here. Until next time, down on the floor and connect to your core. See you next week.